this time, I would like to welcome Dr. Carol Langford, who is the director of the Center for Vasculitis Care and Research at the Cleveland Clinic in Cleveland, Ohio. And Dr. Langford is one of our longtime VF medical consultants. She also serves on the steering committee of the Vasculitis Clinical Research Consortium, the VCRC. She is focused on systemic vasculitis care for all of the vasculitides, especially GPA, MPA, TOC, EGPA, all of them. And she has a brilliant team with her at the Cleveland Clinic. We love Dr. Langford. It's no secret. I tell her that in every meeting. So Dr. Langford is going to be talking with us about the dissemination process, how important it is for us to disseminate the guidelines to the community. So Dr. Langford, do you have a presentation you'd like to share your screen?
Is that okay?
Yes, it looks great. Thank you. Welcome to the platform.
Yes, no, thank you so much. So thank you to the Vasculitis Foundation for hosting this and for inviting me to be here with you today. And what we're just going to discuss in the few closing minutes here as far as is about disseminating this information to your healthcare providers. So again, we've had a wonderful morning as far as it really started out with Joyce's opening comments. Dr. Sharon Chung reviewed with us as far as about the guidelines and most importantly, again, the scientific process through which these were developed. And then you've each been participating in breakout sessions for each guideline, where there's been discussion about examples and Q&A. So certainly the main things you may be wondering right now as far as, well, what do these guidelines mean for me? And how can I share this information with my healthcare providers? And just to sort of, again, recap as far as why, the ACR Vasculitis Foundation guidelines were developed. This has been really a high priority of the American College of Rheumatology, which is, again, our leading national organization for the practice of rheumatology, and really has been an initiative that has been driven by healthcare providers as far as indicating that this is information that they want to have available. The guidelines were developed by the ACR and the Vasculitis Foundation based upon their commitment to providing evidence-based information to healthcare providers in support of their care of people with vasculitis. And the other important thing to keep in mind as far as is that the ACR Vasculitis Foundation guidelines and recommendations were intended to provide guidance for particular patterns of medical practice and in no way to dictate the care of a particular person, which really should be decided, between that person and their healthcare provider. Now, so as you've been listening or reading the guidelines, you may see as far as that your treatment may or may not match what is outlined in the guidelines. And this really demonstrates as far as that the guidelines and recommendations really meant to serve as a general guide, and that treatment decisions will be influenced by factors that are very individual to each person with vasculitis. And the guidelines actively recognize that the person's clinical conditions, their preferences, and their values should influence their treatment. Treatment decisions should always represent a shared decision-making process between that person with vasculitis and their physician. And for that reason, if you have questions about these guidelines and how they might apply to your individual care, that's something that we would strongly encourage discussing with your physician. So some points to keep in mind as far as with that is that some physicians may not actually be aware that these vasculitis management guidelines have been published, and that may include particularly in non-rheumatology specialties. There are also very important healthcare providers, such as physician assistants, nurse practitioners, and nurses that may be involved in your care that may also not know of the guidelines, but have a great interest in these. So how can this information be actively disseminated? So if you do choose to share the guidelines with your healthcare provider, there are really a number of different ways that this can be done. And again, you may determine this based upon your individual healthcare practitioner that you're working with. So you do have the option of providing an actual copy of the guideline. And again, each guideline, keep in mind, is between 10 and 20 pages long as far as based upon the published information. As was alluded to earlier, there are going to be some shorter options as far as there are some pocket cards that are in development as far as being produced. And also electronically, there are means as far as having just electronic access through a website to the guideline. And probably the easiest link is through the Vasculitis Foundation. So even if you just go to www.Vasculitis Foundation, there are links that can get you to this. This is also on the American College of Rheumatology website. And again, if you Google vasculitis guidelines, you can actually pull these up very easily. So there are ways to be able to access this information very readily. And so depending upon your individual healthcare provider, if they prefer the printed word or electronic, there are lots of ways to be able to actually disseminate this information. So in concluding, again, I think the great news is that these guidelines have been developed. And again, this was born out of the great enthusiasm of both the American College of Rheumatology and the Vasculitis Foundation to be able to provide physicians with evidence-based recommendations to assist in the care of managing people with vasculitis in 2021. But I think the even greater news is that, these are not static guidelines, and knowledge is growing and advancing all the time. And one of the comments that came out in our breakout group as far as is, well, won't these be outdated soon? And the answer hopefully is yes. There is a lot of work that is going on across the world in trying to understand vasculitis better. And it is all of our goals to indeed outdate these as soon as possible. And what that means as far as is that treatment will be changing and improving. And with that, we will continue to advance, hopefully, future guidelines that will be able to meet those new advancements that are occurring within the field. So in closing, again, I'd just like to highlight what has been mentioned by so many others during the course of this wonderful conference, is that development of these guidelines really took a team. Certainly, first and foremost, we've been under tremendous leadership of Sharon Chung, who has been with us from day one to present as far as really guiding these guidelines and keeping us on task to develop, a great set of guidelines that can influence and impact patient care. As was heard, as far as this is very much a scientific process, and this work wouldn't have been possible without our methodologists from Dr. Mustafa and Dr. Guyot. There were a tremendous number of people involved in the different teams, from the core team, the literature review, expert and patient panel, and voting panel. We had expert assistance from the staff of the American College of Rheumatology. Certainly, this wouldn't have been possible without the tremendous enthusiasm and support and just overall great guidance that we've gotten from Joyce Coleman, and certainly the support of the American College of Rheumatology and the Vasculitis Foundation. So again, I want to thank everyone for attending this conference this morning and for your interest in understanding more about vasculitis and the vasculitis guidelines. And with that, I'll hand this over then to Joyce.
Dr. Langford, thank you so much for those comments and for all your work on the guidelines. I know you were on all the conference calls I sat on too, so thank you so much for your work. I wanted to ask, after in your breakout session, did you see any themes come out in your breakout session? You were running the EGPA room. Did you learn anything that was interesting or just repeated what you already know about the guidelines?
Yeah, I think the main takeaway as far as, again, is just the tremendous amount of interest and curiosity and desire for knowledge that people with EGPA have. And not just interest as far as what we're doing right now in the guidelines, but what this does mean for the future as far as what should we be looking at next, what should we be expecting as far as from the next set of guidelines. But I think just the tremendous enthusiasm and interest, which is just always very gratifying to see.
Yes, yes. And do you think, as you look at the medical students, the interns, the fellows, the residents who are coming through medical school now, how do you think we can reach them with the guidelines? We have several generations and we're all getting older, or some of us are getting older. And I wonder about how do we educate? So we have our vasculitis experts, then we have the many community rheumatologists, and then we have our patients seeing the NPs and the PAs, and then we have our younger students. How do you see a role for them in how we can reach them?
Yeah, I definitely see a role for them. And this has been a big priority as far as, for us in rheumatology, and really in all of internal medicine, as far as is in trying to educate, our younger people as far as getting them interested in vasculitis. And particularly as far as, again, we recognize that these are people who will be going on to be our next range of medical specialists. And we also know that people with vasculitis don't come first to vasculitis specialists. They are presenting to their family physician, their ear, nose, and throat physician, their internal medicine doctor, their nurse practitioner in acute care. So we want to be able to educate these people. And again, many of us are working at the level of trying to have discussions with medical students to get their interest in vasculitis at an early point, and to get them thinking as far as about things that you may look like one thing, you need to think about less common things, particularly when there are some atypical features. So I think introducing the guidelines at an early point can be very helpful. Again, the younger people have great interest in electronic resources and in learning tools and educational tools like the guidelines, as far as that really is something that they find very interesting and a method of learning that they enjoy. So I think this is something that, we can readily incorporate as far as getting people engaged as far as thinking about vasculitis at an early point.
I agree. Several of the attendees have put some comments in the chat room. And so one person said a periodontist discovered her husband's GPA. Another one said a GI doctor, and, an ENT and an eye doctor. So I think if we can just reach out to those communities and help get this information to them, it will be an amazing. I think these are tools that we need to get out to the community, to everyone we know, to every physician. The VF will be working over the next years to put together different pieces for dissemination. But right now, we are also investigating the pocket guides, both the printed and electronic versions, when they're ready. We have so many people who are anxious to get these out to their physicians. If you can't find the resources library or can't download, please feel free to email the VF office, vf@vasculitisfoundation.org, and we'll be happy to send them out to you. But again, for the sense of time, I just wanted to thank Dr. Langford again for wrapping up today's conference. We appreciate all your work. I'd also like to recognize all the other speakers, Dr. Anisha Dua, Dr. Kevin Byram, Dr. Maz, Dr. Rennie Ree, Dr. Jason Springer, Dr. Lynn, and Dr. Andy Abril. I hope I got everybody because I didn't have a list. Oh, and Dr. Chung, of course. But I would just want to say thank you to all of them for giving their time. And I forgot to thank two special volunteers. Tammy Went and Jen Gordon. Jen hosted the EGPA session and Tammy was in the GCA group. So again, thank you so much for attending today. And I just want to say thank you to everyone for attending. And I hope everybody has a great weekend. Take care.